I'd like to acknowledge the traditional owners on the lands on which we are meeting today, and I pay my respects to elders past, present, and emerging, and to any Aboriginal or Torres Strait Islander people who might be with us today. I'd like to extend a warm welcome to Liz Andrew, who's the Head of Government Relations and Advocacy at the Pancare Foundation. Liz leads the Government Relations and Advocacy agenda for the Pancare Foundation. She works alongside governments, health professionals, industry, and the community by advocating for priority issues and recommendations for change across the cancer continuum that will help to improve outcomes for patients diagnosed and living with an upper GI cancer. In particular, she focused on initiatives that improve the awareness and understanding of upper GI cancers. She aims to improve the quality of life and support available for patients, their families, and also to increase an investment into research. Thank you, Liz.
Thanks, Alison. It's wonderful to be here today and to meet you all. There's a few familiar faces on screen that I can see that I have met before. So it's wonderful to be here. I realise that today I'm probably not the normal presenter that you've had on some of these specialist sessions where you often might hear about dietary or emotional well-being, but today I really hope I can provide you a bit of an insight into some of the work Pancare is doing in the advocacy space to really drive better change and outcomes, and I guess really speak on your behalf and bring your experiences to government and any key influences that are going to help drive that change. So thank you. I've got a few slides to share with you today, just to kind of that we'll talk through together to let you in on how we're progressing things here at Pancare. There we go. So to start with, I thought it'd be nice for you just to hear my story as well and understand why this is such an important space and why I'm so passionate about what I do here at Pancare. On the left of that screen, you can see the lovely gentleman in the middle is actually my uncle, Graham Ma, and he was diagnosed with pancreatic cancer back in 2015. And his story is probably very similar to a lot of you here today, had been experiencing some signs and symptoms, but had put down to other less serious conditions like reflux because he loved his fish and chips on a Friday night, sore back because he was always in the car and working hard. And it wasn't until much later on that he was diagnosed at quite an advanced stage. He's from Bendigo in Victoria, so again, had a lot of different experiences as a regional patient in how to access the best treatment and care, and ended up actually coming to Melbourne to receive his treatment and had surgery by Dr. Mehrdad Nick Sargent, who some of you might know as well. And because he was seeking that treatment away from his home in Bendigo, his family actually stayed with my family in Bendigo for that time. I had a 2-year-old and a little baby that had just been born. And so we got to see firsthand that experience and the challenges and all the ups and downs of his journey. And that really, opened my eyes. I hadn't experienced anything about pancreatic cancer before that. So it certainly opened my eyes into, the challenges that a lot of patients face and just how far behind these cancers are in progress, treatments, funding for research, which really sparked my interest in learning more about Pancare. And subsequently, I actually joined Pancare Foundation about 5 years ago after that, starting off as the marketing and communications manager, and have been part of the Pancare family for a while now in making sure that we can change those outcomes. And along the way, I've met lots of other amazing patients who some of you might know. Helen McGregor is that gorgeous blonde lady up the top, and Jules Jeffress down the bottom, who have all been wonderful advocates of pancreatic cancer and upper GI cancers in sharing their story and helping us drive change as well. And I do feel very humbled and privileged to be able to share their stories and the stories of all of our patients when I am speaking with parliamentarians in Canberra, just to explain and help showcase why these cancers need such strong policy focus and investment. So that's just a little bit about why I'm so passionate about it. And I guess it's probably I don't need to explain to you the challenges that patient's and your family's experience when you are diagnosed with an upper GI cancer. At times, I know you probably feel like when you look at the progress other cancers have made, it can feel a little unfair and challenging. And those experiences are right across that cancer continuum, everything from prevention and early detection, the presentation, diagnostic and staging, through to treatment and supportive care. Upper GI cancers have some really unique challenges all across that. Not to mention, historically, they've been so underfunded for cancer research as well. So ultimately, that's my task, alongside the rest of our team here at Pancare, our patients and our carers as well, is to make sure that we speak with governments, healthcare professionals, industry partners in the community to highlight all of those challenges, to share your stories that can ultimately create change as well. Advocacy at Pancare, and particularly engaging federal government, is something that is been a lot newer for Pancare. We've really only been doing it in a really structured way over the past 12 months. And so it's been a real privilege to be able to lead that part of the work here at Pancare as well. In terms of what our goals are, though, and some of the key areas that we're focused on, it's pretty simple. I'm here to make sure that the 13,000 Australians that are diagnosed each year with upper GI cancer have a voice, to make sure that your experiences and your stories are heard and that you matter in how policy is made, where investment is placed. So the three goals that I really have are to make sure that they are a national priority for government in policy and investment, that we look for improved ways to access supportive care for patients. We know that some of the experiences that sometimes you might have in the hospital, there's gaps, and which is why organisations like Pancare and our PanSupport program are so valuable in your journey across cancer. We also look to make sure that we are fast-tracking any new treatments and that they're affordable treatments on the PBS as well. So I thought I'd give you a bit of a high-level overview and some practical demonstration as to how we're engaging all of those various stakeholders to help drive that agenda. And really, when you look at it, there's various ways that we do that, through developing evidence-based reports, obviously speaking with MPs up in Parliament to lobby government for change and investment. We also contribute to lots of different submissions, whether it's parliamentary inquiries or part of different policy processes that are happening at the moment. Obviously provide recommendations for support in partnership with pharmaceutical companies to make sure that there are positive recommendations made for therapies that are listed on the PBS as well. And we obviously collaborate with other peak bodies on lots of different policy issues as well, to make sure that our voices combined actually can get the best action. So to take you through just a little bit one by one, I guess it all starts in being able to have that evidence to be able to showcase to those people, to governments and all those decision makers on what's actually happening. So some of you may be aware of this project we've worked on. I know Grant, who's on the call today, was one of our patient contributors to this report as well, which was fantastic and a really great example of how, as a patient, you can advocate as well. So this report was commissioned 2 years ago, and its purpose was to really provide that evidence to government and policymakers on exactly what the state of play is at the moment. So we did a lot of consultation with patients and their families, clinicians, healthcare stakeholders, researchers, Cancer Australia, the Department of Health, pretty much everybody, to look at everything across that cancer continuum, from early diagnosis all the way through to treatment and supportive care, and find out where are the challenges and the gaps that we need to address that are going to help build those better outcomes. And although the report does paint a pretty grim picture of a lot of the challenges that patients and their families experience all across that continuum, there is really good reason for hope, and this report has a lot of strong recommendations on what we can actually do, where money can be invested to help actually change some of those outcomes. And so this has been the piece of evidence that we've been speaking with lots of MPs, the Department of Health and Cancer Australia about over the past 12 months to help drive some of that change. It hasn't officially been released yet. We do have a request in with the Minister for Health and Aged Care, Mark Butler, to help us launch this report. And we are hopeful that that will happen soon. It's a really great piece of evidence that will benefit not just Pancare and what we're hoping to achieve, but everybody who works in that healthcare space to help provide better outcomes for patients. Obviously, we're up in Canberra a fair bit. I've probably flown more in my life in the past 12 months than I have in my entire 41 years, which has actually been quite fun because I get to escape my children for the night and my husband has to run the home front, which has been good for me. But we have met with probably over 40 politicians now to really explain to them some of the key challenges that you face living with an upper GI cancer. In that photo below, that's the Assistant Minister for Health and Aged Care, Jed Carney, who we hosted at our Pancare office some months ago, where she actually got to meet our whole cancer support team, so our beautiful nurses, Mira, Jo, Alison as well, just to hear more about some of the challenges and what Pancare is actually doing in that supportive care space to help patients. And on the right there, you can see Mark Butler, who is the Minister for Health and Aged Care, with Mira and Shannon, who bailed him up in an event to make sure that they got to say hi and get a photo with him as well. As a result, though, we've got some really good, strong working relationships with a select group of key MPs. For the first time in Parliament at the moment, there's actually a lot of MPs who are either former GPs or doctors, some are in emergency medicine. So that actually, when we start talking to them about upper GI cancers and the challenges that a lot of patients face, they get it because they've actually seen it in clinical practice before. So they're becoming really good allies as well as we kind of go on this journey to try and get policy change and funding as well. On that as well, we've also got some really good, strong working relationships with Cancer Australia, which is the peak body for cancer in Australia, and the Department of Health, who essentially hold the purse strings for how different health initiatives are funded in this country too. Another key area that we focus on is regularly contributing to key policy issues, and that's through different processes. There might be consultation processes or the call for formal submissions on various health-related aspects. And this is really about, again, providing that evidence and using that evidence that we've had in the State of the Nation report and the experiences that we know our patients face in being able to put that forward too. Importantly, though, it's that we provide the recommendation on what can be done to actually help improve those outcomes. And there's been, you might have again seen it, whether it's in media or through some stuff that Pancare's spoken about, some of the recent submissions that we've submitted to is the National Pancreatic Cancer Roadmap, which was released by Cancer Australia a few years ago. And that really looked at, again, across that whole cancer continuum, different ways that we could improve the system or supportive care for patients living with pancreatic cancer. Just recently, the Australian Cancer Plan has been released, and I'll talk more a little bit about that later on. But again, that was actually our submission focused on, well, in the broad scheme of cancer in Australia, here's actually the experiences and the challenges that people living with upper GI cancers face, and here's what we want to see featured as part of that plan. There's also been the Aboriginal and Torres Strait Islander Cancer Plan, and that's really important for us because Aboriginal and Torres Strait Islander communities actually have a higher incidence rate of upper GI cancers than the general Australian population. So their challenges and their experiences are vastly different. Their outcomes are generally poorer, and so we need to make progress in that area as well. And recently, there's been a Senate inquiry for rare and less common cancers, of which upper GI cancers are considered rare and less common. So again, we've put forward the challenges and the recommendations that we need to see happen to improve outcomes for upper GI cancers. I think the important thing to know is that often a lot of these calls for submissions and participation in inquiry are publicly available. And so there generally is always opportunity for you as a patient to directly contribute to a lot of these submissions. And we'll always do our best to notify you, whether that's through our Pancare website or the socials, or I'll provide that information to the Cancer Support team. For you to make sure that your story and your experience is actually heard. And I think it's really important when we all actually can use our voices collectively, because everyone will have such a unique and different experience depending on the type of cancer that you have, your other life circumstances. You might be in a regional or rural community, and so your experience is very different, and to make sure that that voice is heard is really, really important. The other key area of work, and it's a really complex and often frustrating one, but has a huge area of need, is to support new therapies that come into the Australian market. I guess for upper GI cancers, there hasn't been a lot of new progress in therapies and treatments over decades. And that's something that, you know, we're really hoping that we can add some value to, and hopefully help fast track those ones. So where we often work is with industry to provide the recommendations of support to make sure that new therapies either can come into the Australian market or that they are recommended to be listed for the PBS. Often, again, this is a process that you as a patient can be directly involved in, to submit your experience on what it's been like, either being diagnosed or undergoing certain treatments, and the benefits that a new therapy might be able to provide you as well if a new drug was to be brought into the country or listed on the PBS. And I guess from our perspective, for us as a patient organisation, it's really important that we want to see equitable access for all therapies. It shouldn't be about if you have money to pay for treatments. You know, it upsets us when we see patients having to crowdfund to get access to money to be able to pay for therapy. So we want that equity of access for everybody, to make sure that it's fair and that you as a patient have the best outcome or best possible outcome. So some recent examples of how we've actually helped that process is on screen. You can see there. I'm not going to try and pronounce these drug therapy names because I always get them muddled up. But we've supported 2 applications for the PBS reimbursement for a biliary cancer treatment and an esophageal cancer one. And that was a fantastic result to have those therapies now recommended. They're already available. Obviously, if you were on one of those treatments, you would have been paying quite a lot of money to have that treatment unless you're on a compassionate access scheme through that pharmaceutical company. But this now means that when it is announced, those new therapies will be available on the PBS, which means it takes that cost of a course of treatment from often tens of thousands of dollars to a now much more affordable rate, which means patients aren't having to make that decision about, do I remortgage my home? Do I have to crowdsource to pay for this therapy? It becomes much more accessible. And that's a key thing that we're obviously wanting to contribute to. In terms of how patients and how you can actually contribute to that process, it is a little bit clunky at the moment, and there's a big review happening called the Health Technology Assessment Review, which I'll talk a little bit about in a minute, that will hopefully make that process for you as a patient to engage in a lot easier, so you can make sure that your lived experience and that your journey is considered as part of that process. Which brings me to, how do we actually work with others to make sure that this happens as well? So we obviously, collaborate with a lot of other different organisations, whether they're other healthcare, like not-for-profits working in this space. They might be industry partners or various alliances like the Australian Pancreatic Cancer Alliance that Pancare sits on, to make sure that upper GI cancer is at the forefront of some of that decision making as well. So some key issues at the moment that we're adding our voice to, along with others, is that Health Technology Assessment Review. And if you're not familiar with it, essentially it's the process of how new treatments and technologies are evaluated into Australia, and then whether they're considered for PBS reimbursement. So this review is the first of its kind in over 30 years, which is pretty significant, and it's been a lot of talk across the nation about this, of how it's going to happen. And in a nutshell, it's looking at that whole medicine's life cycle, and particularly on how patients can be more engaged in that process, and that patients are central to all decisions across the life cycle of those medicines. So at the moment, for example, the average time that it takes for a new therapy to go from the TGA, so that's the Therapeutic Goods Association registration, to when it's then listed as potentially a medicine that's available on the PBS is almost 400 days, which is completely unacceptable. And we know for patients who are living with rare and less common cancers, time sometimes isn't our greatest friend. And so we're really calling to make sure that that process is considered and that they look for ways to make sure that that number can be significantly reduced. We also want to see a greater way that consumers can be involved in that process, where you're engaged earlier, that your feedback is considered, that it's easier for you to submit your feedback on the response as well, and that how medicines are then ultimately deemed cost effective is not just purely considered on an economic, benefit scale, but other considerations are put in place, like the patient experience, your quality of life, and that equity. So that's why it is a significant review, because it hasn't been done for 30 years. And a lot of different patient organisations are all contributing to that process. You might notice on that photo on there, the lovely lady in the middle, that's Jan Stuckey, who I know is one of our lovely patients in our support groups a lot of the time. I know Jan couldn't be here today, but Jan, an example of, the advocacy and the role that patients can play in this space as well is Jan and I were invited to attend a roundtable up in Canberra just recently, that was all about discussing that HTA review. And so Jan was able to put forward her personal experience, some of the challenges that she's faced as a patient. Fortunately, she hasn't had a lot of challenges accessing medicines, but she's acutely aware that that situation may change. And so she's really used her voice to advocate on behalf of all patients to go, we need a fairer system in place. So it was great to meet Jan face to face, and it was great that she was able to share that experience with everybody there too. The other one that you may have seen released recently is the Cancer Australia plan, Australian Cancer Plan, which has been led by Cancer Australia. And that piece of policy is really what they want, what the Australian government want to look at for the next 10 years to make sure that we improve cancer outcomes for everybody. We know in Australia we've got quite a good healthcare system, and generally our supportive care system is really, really good, but that's not equal for all patients. It's certainly not equal for patients who might have a rare and less common cancer, but also for other at-risk communities like Aboriginal and Torres Strait Islander people living in rural and remote areas, and anyone who's from a culturally and linguistically diverse background. So the plan is to really try and balance that approach and make sure that everyone has access to good treatment and care. It's been a couple of years in the making, and again, that's another area that Pancare have contributed to actively through formal submissions, meeting with Cancer Australia, having our patients also contribute to that process too. And with the release of that, it's now broken up into 6 key strategic objective areas that are again across that cancer continuum, from early detection, the experience that patients have, workforce, and the like, to make sure that we can include that too. The implementation plan's released, and there is a lot more announcements that we are expecting to happen on that. We have been talking regularly with Cancer Australia, and we'll certainly be having more meetings with them to look at how Pancare can contribute to the implementation plan, and particularly make sure that the needs of our community, being upper GI cancers, are considered as part of that as well, and so that we are starting to see some change happen there too. Another key area is today, you might be aware of, is actually World Pancreatic Cancer Day. So this is an initiative and another great advocacy opportunity, and an initiative of the World Pancreatic Cancer Coalition, of which Pancare is a part of. There's over 100 organisations from 40 different countries that sit on this World Alliance to really highlight the challenges of particularly pancreatic cancer and what we can do to help create change. The Australian Pancreatic Cancer Alliance, which consists of a lot of other organisations that operate in that pancreatic cancer space in Australia, have all been working together behind the scenes to run an initiative that started last night and will be on again tonight, which is to light a lot of monuments of buildings and landmarks in Australia purple in a bid to help create awareness as well. So there'll be lots of stuff that's happening on Pancare's social media during the day. Again, Jan, who's got quite a bee in her bonnet to make sure that her local community understand and hear more about pancreatic cancer, has just had an article appear in the Gold Coast Bulletin today. So she sent me that news piece too, which was great to see. Just it becoming more mainstream and have it featured in the paper, a news cycle, just to make sure more people are aware of pancreatic cancer. I guess just in final, as a patient, there's lots of different ways that you can be involved in advocacy, and it is completely dependent on your personal preferences and how much of your story you like to share. But there are lots of ways that are either passive or very active, and I've just listed a few suggested ways that you can always help contribute to the work that Pancare is doing to help drive that advocacy agenda. So, like Jan, you can share your story. There might be the local newspaper that you could write to and have your story featured. You might like to share your story on social media and have your friends reshare it. And today, being World Pancreatic Cancer Day, if you are a patient living with pancreatic cancer, is a great opportunity to help make that awareness known. Whether it is, here's the signs and symptoms that I initially had and was misdiagnosed or I wasn't aware of, please make sure you understand and know what to do if you are experiencing these symptoms. Along with some of those other initiatives like the submissions that I was talking about earlier, is you can always respond to surveys. There's lots of focus groups, often for research projects. There's consumer advisory groups as well. And I know the PAN support team through the newsletter will often notify you as a patient if there's any opportunities where you can get involved in things like that too. Obviously, with the PBAC, there's opportunity to share your experience and what a new therapy could mean for you. And that's a way for I guess you on behalf of all patients and patients in the future to help advocate for change too. And another one which I'm quite passionate about is, you could speak with your local MP. Although I've met with a lot of different MPs in Canberra, and as much as I would love to fly as many patients as I could up there to directly share their story with an MP, it's not always possible. But if you have a local member, whether it's state or federal, you can actually request to have a meeting with them, and they are then duty bound to kind of do something about it as well. And I'd be more than happy to help you if that was something that you wanted to do in speaking to your MP. I can provide you with information on what you might like to share, some of the work that Pancare is doing and what we're calling for. To make that a little bit easier for you. I've put my email address on screen there, so you are more than welcome to email me if you like. Otherwise, you could always speak to any of the lovely PAN support team and they can connect you with me. So I guess just before I finish up and maybe take some questions if you like, some of the key things that Pancare is really advocating for at the moment, along with some of those goals that I initially listed, is that we are needing more funding for our PAN support service. The rate of upper GI cancers is growing. We are experiencing patients who have some really complex needs, not just through the nursing support that we have, but emotional wellbeing, the dietitian support as well. So that's one area that we have been lobbying for, is that we do need more funding for that supportive care service as well. And hopefully, even though it's generally always a long process when it comes to government advocacy, things don't happen overnight. We do believe we've now got the right team around us and the right people to hopefully create that change. So that's all I really wanted to share before you kick on with the rest of the support group. But yeah, just did want to say that it is an absolute privilege to be able to use your experiences and share your stories when we do speak to Parliament. And please know that we are doing as much as we can to make sure that you do have a voice up in Parliament, that your life matters, that your story isn't forgotten, and that it is being shared. There's a lot of other organisations that we take a lot of learnings and hope from on how they've been able to drive change in the past, whether it's across breast and prostate cancers. And we know that there is a lot of work ahead of us to do, but we're really hopeful for what that future looks like. And would certainly, welcome any discussion with you if you've got ways that you would like to be involved in this advocacy process too. Thank you, Alison.